Good evening. My name is Dr.waleed. I'm from Palestine, Bethlehem. Today we'll speak about croup or tracheolaryngobronchitis. It's a disease of the upper airway. It's caused by mainly parainfluenza viruses type 1 and type 2. 75% of cases is caused by parainfluenza virus A and 1 and 2. The other 25% of patients may have croup due to influenza viruses and RSV. There is a reported cases of bacterial cause of croup. It's more common in male than female. It occurs between October and March, mostly after the midnight. Prior to croup, 1 or 2 days, the patient will have signs and symptoms of upper respiratory tract infection, like coryza and runny nose and coughing. The clinical manifestation of croup, most important sign is barking cough. Barking cough, it's called like this because the cough is resembling the call of sea lion. So we call it barking cough. The second sign, stridor. In croup, the stridor is mostly inspiratory one. So we have barking cough, inspiratory stridor, and fever. Fever could be low grade 1. And we meet many patients with this typical picture. For us as doctor, when we establish the diagnosis of croup, we must know what is the next step. If you have the above mentioned symptoms and signs, we will order anterior neck x-ray. At the anterior view of the neck, we will see what we call steeple sign. The steeple is remind us about the sharp steeple. So we call it steeple sign. It's the narrowing of the upper way. It's the narrowing of subglottic area. So we will have steeple sign. We will have the signs and symptoms like barking cough, stridor, and fever. After the establishment of diagnosis, we will go to the treatment. The treatment of the croup. The first thing that we must know the degree of croup that we are dealing with. It's mild one, moderate, severe one. So we are using what we call Whistler score. Whistler score have 5 subgroups or 5 points that will give us this score. The first one is the presence or absence of retraction, the air entry, cyanosis, and barking cough and stridor. We use all of it to establish the score. If the score less than 2, it's mild one. If the score between 3 and 5, it's moderate croup. If the Whistler score is 6 to 11, it's severe form. If it's more than 12, that means we have a patient with pending respiratory failure and he must be managed urgently by doctors. The medication that we use in croup, there's 2 important medication that we can use to manage croup. First is racemic adrenaline. We use the racemic adrenaline inhalation for patients with croup. It will decrease the edema and it will improve the air entry. Second, it's dexamethasone IM. Dexamethasone IM in dose of 0.6 mg per kg could treat the croup and decrease the severity. But many students are asking us why we give the dexamethasone IM, not IV for patient, because we need the infiltration effect of dexamethasone. When we use the racemic adrenaline, maybe we will get what we call rebound effect of epinephrine, that the patient will develop restenosis of the upper airway. But when we give dexamethasone prior to inhalation, we will prevent that. So we will use dexamethasone, we will use racemic epinephrine. Some books and some articles are talking about the use of oral prednisolone in stable patients who have no respiratory distress. If the patient is stable, we can use oral steroids and it will decrease the intensity and severity of disease. Nowadays we have steroid inhalation like budesonide. It also used to decrease the severity and treat croup. So we will treat croup using racemic epinephrine, dexamethasone IM, steroid inhalation. The patient must be followed carefully. Last, I would like to thank you for watching, and I would like to excuse you if I have some mistakes in my first video about medicine, and thank you very much.